Hi everyone, it's Mr. Sinti, and today I'd like to discuss with you the anatomy of the skeleton. And in particular, I want to emphasize uh, various bone shapes in terms of the anatomy, and also really emphasize the markings on bones. And markings on bones, I'm not sure if you've given it much thought before. Maybe you have some background in that. But what I will say about markings of the bones is that it'll serve us well to know them, because these markings are crucial in terms of where blood vessels are coming in and out of the bones. They're important where ligaments and tendons are attached. And so they're really the foundation, if you will, of understanding anatomy of the skeleton. And so I hope you're going to enjoy this presentation. And so osteology, the study of bones, is practiced by osteologists. So I guess for the moment, we're osteologists. And so bones are classified, amongst other things, by shape. And there are also various markings will classify bones as well. And so here are the 6 typical shapes of bones. There's sutural bones, irregular bones, short bones, flat bones, long bones, and sesamoid bones. Okay? And sutural bones, I mentioned, are found in between sutures in the skull. Irregular shaped bones are found, for example, in the vertebrae along your backbone. Short bones are found in your wrist or carpal bones, also found in tarsals, sort of rock-shaped bones. Flat bones may be obvious, are the flat bones of the skull, like for example the side of your head is the parietal bone or occipital bone in the posterior. And long bones, again, are typically long, like for example the humerus or femur, but they don't have to be that long. They could be short, like for example the metacarpals of your hand. And sesamoid bone, an example of that is patella. I'm having a difficult time pronouncing that. So sutural bones, again, just to point out, suture is where bones are articulating in the skull, and so it's an immovable joint. So it's not moving. These sutures right here, where they come together or articulate, and it was first described. This bone right here this suture that comes down and then sort of pairs off, sort of looks like the Greek letter lambda, and so it's lambnoid suture right here. This one. Now, these sutural bones were first identified, they're sort of like these little islands or jigsaw bones. They were first identified by a professor at Copenhagen University, of all places, in the 1600s, by Ollie Worm. And so sometimes they're known as Wormian bones. And they will vary between individuals on how many you have in the actual size. They can vary from the size of like coins, like a quarter or a nickel or a dime, to small little tiny ones, like for example grains of sand. And so again, these irregular shaped ones are vertebrae, and they could be your pelvic bone as well. They're just sort of your junk drawer of irregular shaped bones. These short bones, again, are carpals or tarsals that make up your wrists and ankles. And flat bones, I mentioned before, could be your parietal bone, which means the side bone of your skull, but it could be a flat bone. For example, your breastbone or sternum is an example of a flat bone right there. And long bones, again, are long and slender, as the name implies. Like, for example, bones of the forearm, your radius and ulna, are example of long bones. And pictured here, your humerus, which is in your upper arm. And sesamoid bones are an example of that is your patella, all right, or kneecap. Now, the rest of this discussion is going to be about bone markings, and that's going to be very important. And there's some basic criteria here that we're going to be looking at, but I'll get more into the detail. This may not mean anything in and of itself in the beginning, but I thought I'd outline it. So we have depressions or grooves in the bone structure. So indentations, if you will, along the surface. And then we have elevations and projections that are sort of like these like pokey points that are coming from bones. And they're basically where tendons and ligaments attach, and there are at articulations with other bones, where, in other words, where bones meet. And so when I say tendon, it means where muscles are attaching to the bone, and ligaments are where bone to bone are attaching. And those are both two different types of connective tissue. And tunnels are, as the name may apply, openings where blood vessels and nerves can enter into the bones. Okay, and so elevations and processes. I want to projections. I want to first look at processes and sort of these angles or branches called Ramus. And then openings will be sinuses, foramen, fissures, and meatus and canals. And we're going to take a look at these. Okay, so the very first one is, I don't want to play favorites, but it's very important in terms of the skeletal system, processes. And so they're basically projections or outgrowths. So this one is a really obvious projection right here, or a process. So you see how it's coming off of the temporal bone right here? Styloid process. It's featured here in red, sort of like a stylus or a pen or stiletto pointed shoes. So temporal stylus, that's an example of a process or an outgrowth. The vertebrae have very famous processes. One's coming off to the sides here, or transverse process. And then this process coming off is the spinous process right over here. This is, again, the side view of a lumbar vertebrae. In other words, a lateral view. Okay, and there are the points of projections coming off of the bone. What's the point in these transverse processes? Well, as I mentioned before, there are attachments for muscles and ligaments, like tendons and ligaments, as well as, if you will, the ribs also can attach to the spine via these processes. Just to show you a different location in the body, your jawbone or your mandible has this coronoid process right in here. So it's a projection or an elevation, coronoid process in the mandible. Okay, and now this sort of extended, this is still under the criteria of projections, this extended portion of a bone, from the Latin ramus, meaning branch. This is your mandible right here, or ramus right over here. This extension, this region right here of the mandibles is referred to as a ramus. Also right here in your ischia, the ischial rambus right over here, or branch, is another example of a ramus. Openings. Now, most of us are familiar with openings. Like, for example, if I mention sinuses, you would already know what I'm talking about. Sinuses are these sacs or cavities from the Latin, meaning bay or pocket. And they're, one of their main functions is to lighten the sheer weight of the skull. And so we have these sinuses. We have over here the frontal sinus. We have maxillary sinus right over here, which is in your maxillary bone. These are all collectively called your paranasal, meaning to the side of the nose, sinuses. Okay, so sinuses are features of bones. And so we also have openings. And so foramen, meaning opening. So this opening in the base of the skull, as you can see it, if you look at this, this is looking up at the skull, and this is the occipital bone right over here, the back of the skull. It's an inferior view, I should say. This is the foramen, which is an opening, but it's magnum, meaning it's a giant opening. A giant opening, or foramen. You might be familiar with, this is a skeletal discussion, but there's a foramen ovale, which is an opening in the fetal heart. Here's a very small foramen right here, which is right below the orbit of the eye. As you can see here, it's the infraorbital foramen right over here, where I'm pointing with the cursor. Okay. Now, there's these fissures. If you could see in the back of the orbital here, a fissure or a slit right here, this furrow right in this area right here is a superior orbital fissure. That's another example of an opening or a fissure. Okay. Meatus. Meatus is also an opening or a hole, if you will. It's leading to the interior part of the body, meatus. And one of the most famous is inside the skull. And this is looking lateral view at the right temporal bone. So right over here. And you might think that this is obvious, but this external acoustic meatus is basically the opening of which enters into the skull. This is basically where your ear is attached on the outside, this opening right in here. Okay. And then this is, again, an opening or a canal. You can see right here this optic canal. And this is, excuse me, the sphenoid bone. And again, this is looking inside the skull. This is looking down. This is the ovale, the foramen, I meant to say, the foramen looking this way. This bone right here, or sphenoid bone, sort of has these greater wings and these lesser wings. And as you can see, these canals are areas in which the optic nerve is able to penetrate from the back of the posterior part of the eye, and it enters into the brain right in this area right here through this optic canal. It's pretty cool. So the canals are for the optic nerves. And this is the superior view, again, as I mentioned, sort of looking down on the sphenoid bone. Okay, and so now let's take a look at other kinds of markings like depressions and various other processes over here. So we're going to look at processes where tendons and ligaments attach and articulations between the bones. And we'll use humerus and femur as an example of that, but I have some other examples as well. Some of these are obvious, some of the terms you may have not heard of before, but they're all fairly important, I might add. So sulcus, sort of like to sulk or to be depressed. It's a narrow groove or a fissure. So tubercular sulcus, is found right in here. This sulcus is this groove in between these two tuberculi, right in here on the proximal end of the humerus. And this sort of groove right in here, this sulcus, right in this area right here, tubercular sulcus, is important because that's where the tendon, which connects to the biceps brachii muscle, is going to be overlapping right in here in the head of the humerus, and again in the proximal area. It's a depression in the bone. So right in here is the sulcus, right there, and that's where a tendon is going to sit. So it's kind of nice. Fossa. Now, a fossa is a flattened or depressed area as well, shallow depression. And so this is the skull sort of upside down. This is the mandible ramus, as you can see right over here. This is the depression right over here. It's a mandibular fossa, which articulates with the mandible. It's a little depression right over here. You could see it right over here. Okay, fossa or shallow depression, right there. Okay, trochanter. Now, a trochanter is a sort of large, and I try to emphasize that by using a larger font here. So a trochanter is a massive projection, and it's usually kind of rough. And you can see here, there's different types of trochanters. This one is called the greater trochanter, and this one is the lesser trochanter right over here. And there are these big projections, and this, for example, in the femur. Okay, and this is the proximal end of the femur, where you can see the head is right there. Okay, and so again, another viewpoint right over here. This is the proximal end of the femur. Here's the head right over here, and the neck. Here's the greater trochanter, again a massive, large projection, and the lesser trochanter right over there. Crest. So a crest is a prominent ridge. So it's sort of like the crest of a mountain. It's a prominent ridge, and a great example of that is the iliac crest right up here, which is the top of our hip bones. And you can actually feel that if you palpate the hip. And if you've ever had a hip pointer, which results in damage or to blow to that crest, it can be rather painful. And I want to also point out that the iliac crest is also a place where a physician, a surgeon will do a bone marrow biopsy. and this is an area where there's red marrow found in the crest region where blood cells are produced. And so oftentimes the bone marrow is removed or transplanted in this area because it's, believe it or not, it's easiest to get to. Okay. Then we have a term called a spine, and a great example of that is looking at this flat bone in your shoulder called the scapula. This is the anterior view and the front of the scapula, and this is the posterior view or back of the scapula. You have this spine which runs across the top of the scapula posteriorly. Okay, and it's a point where ligaments and tendons can attach. This term line means a lower quality ridge. And so we have in this temporal bone in the side of the skull, we have a superior, meaning towards the top, superior temporal line. And then we have an inferior one down below, an inferior temporal line. And again, it's just a low ridge in the skull. Tubercular, we have small rounded projections. And so what we can find over here is an example of that is the pubic tubercula, which is shown right here. It's a projection and it's sort of rounded shape right over here in your hip. Tuberosity. The tuberosity shown here is another sort of heightened projection or ridge found in bones. Again, these are all examples of markings of bones. The deltoid here, this is the humerus bone right here, and the deltoid is a muscle. The deltoid tuberosity is where the deltoid is going to be connecting to the humerus, and it's a ridge that extends down the humerus right there, tuberosity. Okay, you can also see it over here in the humerus, the deltoid tuberosity. Okay. Tubercle are these projections I pointed out before. Here's an example of a line, and here's a spine of the hip and the crest, the iliac crest. Okay, so these are all markings, and so let's move over to look at these ones: head, neck, facet, condyle, and trochlear. Okay, so the head is an expanded part of a long bone. If you recall these terms right here, the epiphyse, or sort of the this region right here of the bone, and diaphysis, which is the shaft of the bone right here. The head is this sort of extended ball-like region of the bone, and it's separated from the shaft of the bone by this region right here, the neck. And the neck is kind of a vulnerable region in terms of, this is an area where fractures or breaks could occur anywhere, but if a place is going to be most vulnerable, it'll be in this neck region right here. And it's a connection between the epiphyse and the diaphysis of the long bone is the neck. Okay, and facet is a small area that's often flat. Here's a facet surface right here. This is the vertebrae. It's small, and it's where bones will articulate with one another. As you can see here is the facet joint between one vertebrae and another. So a small flat surface. Sometimes bone spurs can occur, which could be rather painful right here. This is a normal facet, and this is one with some spurs over here. And so I was sort of poking around. There's a restoration device called a glider facet restoration device that often offers patients sort of a surgical treatment for lower back pain when the facet spurs start to form right in here. So you can have replacements put in to reduce the pain in that area. Now, condyles are smooth, rounded processes that articulate, and in particular, the mandibular condyle, which is this area right here of your jawbone, condyle. So it's smooth, rounded processes. Some of the more famous condyles are the condyles of your femur or your thigh bone, and this is looking posteriorly. And here's Here's the lateral condyle to the side, and this is a medial condyle. So there's these flattened areas right here. Okay. Again, if you look over here, here's again posterior view. Here is the medial condyle and the lateral condyle right here, and then in between is the intercondyle notch, or fossa, if you will, or depression, fossa or notch. And this is the patellar surface right over here, which is the anterior side of the femur. You always know that the head, where it's attaching to the hip, is on the medial side, maybe obvious, of the femur. Okay, the trochleal marking is this sort of grooved articular process. In other words, where bones are attached, sort of shaped like a pulley. In other words, it has sort of this little indentation right in here. And so this is found in the humerus, and you can notice here the anterior view and the posterior view right in here. So this little ridge right in here and right over here. Okay. Here you're looking again at the anterior view. This is the distal end of the humerus, and you can see it right in here, this sort of smooth grooved area right in there. Okay. So I hope you enjoyed this brief look, and I hope it serves you well. Again, I mentioned in our future conversations or your own personal future study of the anatomy of the skeletal system, surely these terms will appear again and again because they're found throughout the body and the skeleton. So I hope this was a good introduction to bone shape and bone markings. Thanks for watching.